welcome to this episode of Kidney Conversations. This is a new episode that comes to you from the Indian Society of Nephrology social media, and it's a social media initiative to look at things that are being done here in India that people may not have heard about, and that's something that we want to put out there to show to people that these things are being actually done. I am Dr. Arvind Kanchi. I am a nephrologist and transplant physician in Bangalore, as well as the chair of the social media team of the Indian Society of Nephrology. Now, my first guest in this Kidney Conversations is Dr. Gireesh Reddy. He is a consultant nephrologist and transplant physician based at the Institute of Nephrology in Bangalore. He is also a consultant interventional nephrologist and heads the Interventional Nephrology Fellowship that's being offered by the Institute of Nephrology. He's had training in various places like Davangere, Pune, and Chennai, and he's done his Interventional Nephrology Fellowship in New York before returning to India. Hello there, Gireesh. How are you doing?
Good evening, sir. I'm doing great. Thank you for this wonderful initiative, sir.
So, Dr. Gireesh, the first question is I just need to lay a platform on how things are out there in the Institute of Nephrology. It's a big government hospital, caters to a lot of people. So, how do you look at the numbers in Victoria Hospital itself, inpatients, outpatients per month, and how do you look at the Institute of Nephrology, as in the inpatients and outpatients and so on? Give us a picture on what happens.
Last year, Victoria Hospital campus of Bangalore Medical College saw a patient footfall of around 1,33,000, which includes both inpatients and outpatients. And Institute of Nephrology, as such, had a footfall of 1,833 patients, both as inpatients and outpatients. So there is a huge footfall of patients, and since Institute of Nephrology is one of the apex institutes which caters the entire state with renal disease population, so the patient footfall is huge.
Right. So obviously you set up this interventional nephrology unit in the Institute of Nephrology in Bangalore, and I'd like to know, you have a fellowship, but before we get to that, what are the procedures carried out by your department under this framework of interventional nephrology? Remember, not many hospitals have interventional nephrology in their nephrology units, but you uniquely do. So I'd like to know, what exactly do you do out?
So, as all of us know, sir, end-stage renal disease population require a special and a holistic approach in terms of their vascular access. So, Institute of Nephrology with the Division of Interventional Nephrology offers a 360-degree care to their vascular access. So, right from the planning of the vascular access, which includes ESKD life plan and mapping of the vessels for the creation of access, then creation of access itself, and then surveillance of the access and monitoring the access during their lifetime. And then once the access fails, salvaging the access and also planning the future access. So a 360-degree and a holistic state-of-the-art care for the vascular access is delivered by the Division of Interventional Nephrology.
Right. So apart from this that you do in your cath lab and so on, you obviously have the more, common garden, if you can call it that, catheters and biopsy and PD cats and so on. Tell us a bit about that.
Yes, sir. So on an average, around 5 to 6 renal biopsies are done every day in the institute. Then PD catheter insertions would be a little less frequent because we have a cap on the number of PD therapies we can deliver. So probably 1 or 2 PD catheter insertions in a month, and then catheter insertions would range somewhere around 6 to 10 per day. So that averages close to 350 in non-tunnel catheter insertion per month. When it comes to the tunnel catheter insertions, it's close to 20 to 30 tunnel catheter insertions per month.
That's excellent. That's really big numbers. So you have curated a fellowship in internal nephrology in your institute. Discuss that. How does one go about applying for it? What does a doctor or a nephrologist learn during this course? And how much of it is hands-on training for the training?
Yes, sir. Uh, Interventional nephrology program, it is one of its kind because it's a university accredited interventional nephrology fellowship program. So the Rajiv Gandhi University of the Health Sciences accredits or a fellowship program, which adds to lot of value. And since it's a university program, we have an entrance exam which all the interested and eligible candidates have to take, and the merit list is put up, and the first two meritorious students get an opportunity to join our fellowship program. During our fellowship program, the fellows have exposure to national faculty and some of the international faculty. They also visit our center and offer their insights. And within the national faculty, there are a multitude of national faculty, like surgical creation of AVF is taught by some of the national faculty. Then during their 12-month endovascular program, the fellows get a complete hands-on training, because since I was trained in New York, we believe in training the fellows completely hands-on. Like, right from their initial days, the fellows train themselves as they are the primary treating consultants. Apart from the endovascular procedures they do in the cath lab, as I mentioned before, the fellow also gets exposed to the pre-operative or pre-procedural workup of a patient, post-procedural management of a patient. So they get a complete hands-on training and a good orientation towards the comprehensive approach for the vascular access care.
I understand that the Indian Society of Nephrology also recognizes this fellowship, and you're on that particular sort of
Yes, sir.
setup as well.
So, along with the two seats which we have for this interventional nephrology program, Indian Society of Nephrology also sends one of the nephrologists for this fellowship program. So that's a 6-month fellowship program. So the candidates are decided by the Indian Society of Nephrology, and we offer that fellowship program as well, sir. And all of them, all the fellows get a hands-on training, and our volumes are good. So yeah, it's a good comprehensive program, sir.
Excellent. Now, is Bedside Focus a part of your interventional nephrology course? What sort of examinations do you do if you do Bedside Focus? And are there any procedures being done using Bedside point of care ultrasound?
Yes, sir. Bedside focus includes volume assessment, then the mapping of the vascular access, and also the screening of the kidneys for biopsibilities. So a complete head to toe focus examination is done bedside by our interventional nephrology fellows, and they also teach our nephrology residents. And we do ultrasound guided endovascular interventions, which is one of our main focuses. The idea is to simplify the interventions as much as possible. So, along with the regular focus, we also do endovascular interventions, which are bedside ultrasound guided interventions as well.
Excellent. On a personal front, what exactly made you choose to go into interventional nephrology? Most of us, do core nephrology, ICU nephrology, and then go into transplant nephrology. And we are basically jack of all trades here in India. People tend to go into transplant nephrology by themselves. Some choose to be in the ICU, some choose PD, and so on. What made you decide to go into interventional nephrology as a part of a specialization beyond nephrology as such?
Sir, as all of us during our nephrology training are exposed to the dialysis patients very often, and in fact, that forms the core of our training. And then, when I was doing rounds in my dialysis unit, or whenever I was on call duty, the majority of the calls used to come from dialysis unit, saying that there was a difficulty in vascular access, whether was it a cannulation, or like some of the patients would complain that my fistula was functioning, and just now after the staff has cannulated, it has stopped functioning. So the access problems were multitude, and it was an helpless situation, because every time attending to access problems in dialysis patients and not able to do anything about it propelled me to think what was a solution for this. And the other point why I chose was I always strongly believed that the cost of the procedure, the affordability of the patients towards these procedures becomes better only when a nephrology starts doing these procedures. So that was the whole intention that I chose interventional nephrology, and the opportunity to save the patients and the opportunity to prolong the patient's life and preventing their mortality because of access failure really drove me towards this interventional nephrology training, sir.
Thanks, Gireesh. I just want to make a last statement. Can you just inform our listeners here on how they should apply for this course? When is the course open? The intake? Where do they look for it on the website? And so on. Give a last sort of statement so that people can actually apply for your course. I know that your intake for this year is over in August, but how do they go about having listened to this broadcast from us? They will be itching to know how to get on to your fellowship.
So the fellowship generally starts between September to October, which is a standard time from Rajiv Gandhi University of Health Sciences. Then we generally advertise once the university gives us a notification about this fellowship program. So either it is online or through all the social media platforms, the residents can watch out. So generally, the advertisement for the fellowship would be somewhere around August to September. The entrance exam is also held between August to September based on the university notification, and all eligible people can apply through online, or they can send their application forms to our institution's address. They have to go through the entrance exam, and the top two meritorious people will get to join the fellowship program. And in case they miss out on this university fellowship program, ISN also offers them to get into our fellowship program for 6 months through the ISN selection process.
Excellent. Thank you, Dr. Gireesh, for being such a lovely guest on this show. Thanks a lot for giving this info, and congratulations to you on establishing this unique interventional nephrology fellowship and having so much to do with so many numbers in your institution. Thank you.
Thank you so much, sir.